Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about diseases of the mouth. Your mouth is one of the most important part of your body. It has many different functions. It allows you to take in food and drink, breathe in air, start digestion with your teeth, chewing the food you eat, and your salivary glands releasing saliva to help break down the food, speak and sing, show emotion by smiling or pouting. Any problem that affects your mouth can make it hard to eat, drink, or even smile. Some common mouth problems include cold sores, painful sores on the lips and around the mouth caused by a virus, canker sores, painful sores in the mouth caused by bacteria or viruses, thrush, a yeast infection that causes white patches of your mouth, leukoplakia, white patches of excess cell growth on the cheeks, gums, or tongues, common in smokers, dry mouth, a lack of enough saliva caused by some medicines and certain diseases, gum or tooth problems, bad breath. Treatment for mouth disorders varies depending on the problems. If your mouth problem is caused by some other diseases, treating that disease can help. It is also important to keep your mouth clean and healthy by brushing, flossing, and not using tobacco. Now, let us go some more details of this about mouth diseases, inflammatory and infectious conditions. Next, that is thrush, oral candidiasis, gingivitis, and recurrent aphthous ulcerations, viral infections, tumors of the mouth, squamous cell carcinoma. This is the most common type of malignant tumor in the mouth. It affects mainly older adults and carries a poor prognosis. Congenital disorder, cleft palate and cleft lip. Next is dental caries. Tooth decay starts with the discoloration and then formation of cavities. It arises when bacteria present in plaque on the teeth act as sugars forming acid, which may eventually destroy the hard parts of the teeth. Caries can be prevented by good oral hygiene. Now let us discuss some more details about disease of mouth. Mouth diseases are the range of conditions affecting the oral cavity with common examples including dental issues like cavities and gum diseases, gingivitis, periodontitis, viral infections such as hand, foot, and mouth diseases, and herpetic stomatitis, and other conditions like mouth sores, oral thrush, and mouth cancer. These diseases can result from factors like bacteria, viruses, poor oral hygiene, and other systemic healthy problems. Disease of the mouth. Common oral diseases are largely preventable and often linked to poor oral hygiene, sugar consumption, tobacco, and alcohol use. They can also indicate systemic health issues. Dental caries, tooth decay, the most common health conditions resulting from the bacteria in plaque, converting sugars into acids and erode tooth enamels leading to cavities. Dental caries, a tooth decay, is a common disease where the bacteria in the mouth produces acids from sugars and starches, which then erode tooth enamels and create cavities. This process can lead to tooth pain, infection, and tooth loss if left untreated. Prevention involves good oral hygiene, limiting sugar intake, and regular dental checkups. Next, periodontal gum diseases begins as a gingivitis, swollen, bleeding gums due to plaque buildup, and can progress to periodontitis, where the gums pull away from teeth, the supporting bone is lost, the teeth may become loose or fall out. Periodontal gum disease is an infection of the tissues that hold your teeth in place, starting with the buildup of plaque and tartar from poor oral hygiene. The early reversible stage is gingivitis, characterized by red, swollen, and bleeding gums. If untreated, it progresses to periodontitis, which can lead to a gum recession, bone loss, loose teeth, and tooth loss. Next, oral cancers. Cancers of the lip, tongue, and other oral areas are a major health concern. Risk factors include tobacco use, excessive alcohol consumption, and human papillomavirus (HPV) infection. Oral cancer is a cancer that develops in the mouth or throat tissues, including the lips, tongue, cheeks, gums, and palate. The main risk factors include tobacco use, heavy alcohol consumption, and the human papillomavirus (HPV). Symptoms to watch out for include sores that don't heal, white or red patches, lumps, and difficulty with chewing or swallowing. Next is mouth sores and ulcers. Include canker scores, that is a painful, non-contagious sores inside the mouth, and cold sores, contagious, fluid-filled blisters caused by the herpes simplex viruses, typically on or around the lips. The mouth sores and ulcers are typically caused by minor trauma, stress, or nutritional deficiencies and are often harmless, resolving on their own. However, persistent or frequent sores can indicate underlying issues like celiac diseases, Crohn's diseases, viral infections such as herpes simplex, or weakened immunity. Cause range from accidental injury, certain foods and toothpaste ingredients to more serious conditions like Behçet's diseases and oral cancer. Oral thrush, that is candidiasis, a fungal infection caused by an overgrowth of candida yeast, appears as white patches in the mouth. It often affects the individuals with weakened immune system or those using certain medications like antibiotics or inhaled steroids. The oral thrush, also called oral candidiasis, is a condition in which the fungus Candida albicans builds up in the mouth. It's a natural for Candida yeast, a live in the mouth, but sometimes it can grow too much and cause symptoms. Oral thrush cause creamy white patches or spots, usually on the tongue or inner cheeks. Sometimes oral thrush may spread to the roof of the mouth, gums or tonsils, or the back of your throat. Dry mouth, xerostomia, a condition where not enough saliva is produced, which can affect comfort, speech, and digestion and increase the risk of infection and tooth decay. The dry mouth or xerostomia is a condition of insufficient saliva production leading to symptoms like persistent dryness, difficulty chewing or swallowing, and a burning sensation. It can be caused by medications, medical conditions, dehydration, cancer treatment, and aging, and can increasing the risk of tooth decay and gum disease. Treatment involves managing the underlying cause, improving oral hygiene, and using saliva substitutes or stimulants if needed. Next, leukoplakia and erythroplakia, white or red patches of abnormal cell growth, of often linked to tobacco use. Erythroplakia in particular is often precancerous or cancerous. Leukoplakia is a white patch in the mouth, while erythroplakia is a red patch. Both are potentially precancerous conditions, but erythroplakia has a significantly high risk of becoming oral cancer. The combination of red and white patches is called speckled leukoplakia and also indicates a higher risk. Common risk factors include tobacco and alcohol use, and treatment may involve lifestyle changes or surgical removal of the lesions. Next, orodental trauma. Injuries on the teeth and mouth caused by accidents or violence, potentially leading to tooth loss and significant disfigurement. Orodental trauma refers to injuries to the mouth, teeth, gums, jaw, and surrounding soft tissues caused by accidents, falls, sports, or assaults. It can range from minor soft tissues cut to severe issues like tooth fractures, displacements, or lost avulsion. The severity determines the treatment, which may include re-implantation for a lost tooth or other interventions for fractures and soft tissues wound. So far, we discussed about the diseases in mouth. We have done. Please subscribe our YouTube channel.